By this time of year can be just a wee bit stressful on some folks. You think about the travel, you think about the relatives coming in and taking over your house and stopping at the toilet, and then you go shopping on Black Friday with all the crowds and the elbowing and the fighting over the specials, and then you have to worry about the dinners and the presents and the trees and to make sure everyone's taken. See, my blood pressure is already up. You get a little stressful, don't you? How to deal with that? How to get a handle on the stress before it gets a handle on you? We're talking with our friends from East Texas Medical Center, Brenda McBride. Nice to have you here.
Thank you.
You know, it's just talking about some of that stuff. You get a little bit. The blood pressure can get up a little bit, though.
Yes, it is a lot.
How do you cope? Why is it so upsetting this time of year, do you think? Just because of all the things we have on our plate?
There's a big to-do list,
Yeah.
and one of the things that I notice is that the preparation for the holiday begins earlier and earlier. Yeah. I noticed that the craft stores put the decorations for Christmas out
Halloween practically.
In June, actually, this year.
Oh, gee.
So there's a lot of pressure built around, you know, having this perfect holiday, this one day, and fulfilling that expectation.
You want it all to work so well and be like something out of a Norman Rockwell Christmas or something. What do we do? A lot of folks will say, you know what, I'm going to have a lot of people over, but don't worry, we'll have a lot to drink. That's really not a great thing. We know that alcohol is a depressant. That's not a right way to deal with this depression or this anxiety or anything that comes up this time of year.
Absolutely. Well, there's different things that people can do. I think that the number one thing is to just kind of lower your expectation. Mm-hmm. There are so many excesses this time of year in terms of things that we have to do, things that we have to buy, but there's also a lot in hidden causes of stress that can kind of creep up on us this time of year that have nothing to do with holiday cards or baking. You know, those things can be like having an expectation about how everything is going to be, having an expectation about how we would like our family to behave.
And they don't always do that, do
they? They don't always do that. And so sometimes we get in the mindset that maybe things will be different or we can somehow right a wrong that was done to us. And the truth is, you know, if you've had a critical mother-in-law for 20 years, there's probably not going to be a personality transplant. Not
a magical transplant on Christmas morning, no.
That doesn't usually happen. So sometimes just lowering your expectation can be helpful.
You know, a lot of folks have lost people they love very much, whether it's children, mothers, fathers. Perhaps they've got some youngsters overseas right now. It can be depressing. How do you deal with that? I mean, do you need to you got to talk about it? Do you keep it all bottled up, or what's the best way to help that?
Keeping stuff bottled up actually causes depression to increase, which can sometimes bring on suicidal thoughts and things like that. So the best thing is to talk about it. You know, I actually lost my mom to cancer when I was, you know, kind of at a young age. Sure. And you know, Christmas you have a lot of family traditions and expectations, and you miss those. And so what we did as a family is we talked about the traditions that we liked and the traditions that we wanted to continue, and then things that were kind of cumbersome for our family to do. So it's important to kind of talk about those things and realize, you know, different people feel differently about this situation. And there's kind of a pressure, too, to be happy this time of year, and not everybody feels that, and it's okay.
After all, it is Merry Christmas, but not everybody's merry.
It's Merry Christmas, but, you know, if you have a loss, then that's kind of amplified this time of year. So it's important. This is also the time of year that we have a tendency to overindulge in food and alcohol and sometimes spending, which causes more problems for us. So if you can keep up your exercise habits, if you can keep up, you know, some of those important relationships, staying connected with the people that are important, that helps.
And again, if you know someone who's dealing with depression, and depression can be an ugly, dark hole you can't climb out of, what's the best thing to do? Get a hold of you guys, call someone.
Absolutely. You know, there's different types of depression, and certainly this time of year, we need to kind of be on the lookout for seasonal affective disorder. That means when there's less light during the day, that people have a tendency to get more depressed. So easy things you can do is get outside, get some sunlight, definitely exercise. Exercise is just as effective as a mild to moderate antidepressant. Volunteer. You know, it's real easy to get kind of self-involved in a depression, and then you go volunteer at Salvation Army, and you say, kind of get outside of yourself. But, you know, sometimes that's not enough. And when that happens, it's important to contact a counselor. You know, the folks at ETMC Behavioral Health have lots of staff that can help evaluate, you know, if you need some help in dealing with that.
And you can get hold of the folks there through the website, etmc.org. Is that right?
Absolutely right. Absolutely.
If we don't see you, have a very Merry Christmas.
Thank you.
A really Merry Christmas.
That's right. A real one. God bless you.
All right. Take care.